Hello students, welcome to this session. So chapter 12, it is catheter associated urinary tract infection. So in hospital environment, catheter associated urinary tract infection is very common. So today we will study about catheter associated urinary tract infection, then what is the diagnosis, prevention and maintenance of that. So first is the definition. So it is presence of significant bacteriuria in catheterized patient with or without symptoms or signs referable to urinary tract. So significant bacteriuria means colony count should be more than 10 raised to 5 colony forming units on blood agar plate, and with or without symptoms. So if it is with symptoms, it is called significant symptomatic bacteriuria. If it is without symptoms of urinary tract like hesitancy or frequency, burning micturition, or dysuria, that is pain at the site of urination, fever. So if without symptoms, it is called as asymptomatic bacteriuria. So now we will see what are the causative agents, microbiological agents causing catheter associated urinary tract infection. So if the catheter is placed short term, then it is monomicrobial, that is single organism is involved, and it may be more prominently E. coli and then other bacteria like Klebsiella, Serratia, Citrobacter, Enterobacter, Pseudomonas, Acinetobacter, cons, that is coagulase negative Staphylococcus, Enterococci, Candida. Candida is a fungus. So these are seen in short-term catheterization. If long-term catheterization, then it is polymicrobial, that is many organisms are present at one time, and they may be these short-term organisms plus other organisms like Proteus, Providentia, Morgagni. Now we will see pathogenesis. So there are mainly 4 entry points to cause the catheter associated UTI. So first it is urethral meatus and catheter junction. Then second is the drainage tube and bag junction. Third is the entry present in drainage bag, and fourth is at the outlet valve of the drainage bag. Now we will see what are the factors causing urinary tract infection. So it is divided into device related, patient related and healthcare worker related. So first we will see device related. So in that, type of catheter is very important. So which type of catheter is used, that gives the urinary tract infection. Then type of material, whether it is latex, so it is more risky. Then patient related. So female patients are more prone for the urinary tract infection. Then if illness is present, the fever or any other infection, then it is causing urinary tract infection. Old age, that is more than 50 years of age, are more predominantly involved in UTI. Then patient having diabetes mellitus, raised serum creatinine, poor hygiene of the genital tract or incomplete emptying. So these are the patient related factors. Then healthcare worker related factors, so either doctors or sisters or paramedical workers who are inserting that catheter, maybe they are not taking proper aseptic precautions, and that may land up in urinary tract infection. So now we will see diagnosis of CAUTI, that is catheter associated UTI. So first is a device criteria. So in that, presence of urinary catheter in a hospital environment more than 2 days. Then clinical criteria, so any one sign and symptom of the UTI, that is fever, suprapubic tenderness, urgency, so patient feels urgent to go, cannot control urination. Then frequency, so that is increased number of the urination. And then dysuria, it is pain at the site of the urination. Then cultural criteria, so it is significant count is more than 10 raised to 5 per ml of the urine, it is called as significant bacteriuria. And then in that, treatment is removal of the catheter and appropriate antibiotics should be given. Now we will see procedure of catheterization. So in that, hold the end of the catheter loosely coiled in palm of the dominant hand, then identify the urinary meatus and gently insert until 1 to 2 inches beyond the line where you will see urine. Then inflate the balloon using correct amount of sterile liquid. It is approximately 10 cc, and then gently pull catheter until the inflation balloon is snug against the bladder neck. Then connect catheter to drainage system, then secure catheter to the abdomen or thigh, and then place drainage bag below the level of the bladder and above the surface from the ground. Now we will see sample collection. When we have to diagnosis that, how to collect urine sample. So you have to disinfect the tube with the alcohol, and then from the proximal portion of the tube you can collect the urine sample. But urine sample should not be collected from the drainage bag. So sample can be collected from the sampling port after disinfection with alcohol. Then what are the documentation required? So first is indication of the catheterization, why this catheter is inserted, then name of the healthcare worker who inserted that catheter, date and time, daily assessment for need of the catheterization, and daily catheter care should be performed, that is cleaning and emptying of the bag frequently, and then date of removal of the catheter if catheter is not required. Now we will see care bundle for urinary catheter. So what is bundle? So it is group of instructions, so it is called care bundle. So it is for the insertion of the catheterization. So it is catheter should be inserted only when it is indicated appropriately, then only sterile atoms, that is sterile catheter and other things used, then it should be non-touch technique with strict asepsis. So the sterile catheter is used and the part, that is periurethral part, is strictly cleaned. Then continuous closed drainage system should be used. Catheter of appropriate size should be used. Then catheter properly secured by plaster to plaster technique. So it should be secured over the abdomen or over the thigh, and then that drainage bag should be below the bladder level but above the floor level. The maintenance bundle. So daily what things we have to do? So daily catheter and meatal care, that is strict aseptic technique is used. After hand hygiene and single gloves is used for the single patient. Then catheter properly secured, drainage bag should be above the floor and below the bladder level, closed drainage system should be there, and collection of urine from the bag. So separate jug is there for the collection, hand hygiene done, gloves used, and then alcohol swab is used for the aseptic of the outlet. Then daily assessment of readiness of removal of the catheter must be documented. So if it is indicated for the removal, or if any sign of obstruction or infection, then removal of the catheter should be done. So this is a summary of the precautions taken to prevent urinary tract infection. So before catheterization, the person should know knowledge about the catheter type and size to be used, and only the where indicated, that is indication, should be there. Then during catheterization, gloves should be used, then hand hygiene and then gloves used. Then sterile catheter should be used. Periurethral cleaning should be done with proper aseptic precaution. Then catheter insertion should be done with 2% lignocaine. Then balloon inflation should be done and it is secured properly. Then gloves removed and hand wash done. After catheterization, closed drainage system properly maintained. The bag should be below the bladder level and above the floor level, and then emptying of the bag should be done after doing hand hygiene and using gloves, and separate jug should be there for emptying each bag, and then frequently it should be done. Over collection of the urine should not be there in the bag, and then separate container used, then hand hygiene, gloves used, alcohol swabs for the meatal care with soap and water should be done. These are my references from which we can study. I hope this session you will find useful. Thank you.